If you take amlodipine, losartan, or lisinopril for blood pressure, and your numbers have been stuck for years despite taking every pill exactly as prescribed, the problem may not be that the medications are too weak. The problem may be that the medications are working against each other. And the pill that was added to help with the side effects of the first medication may actually be making the entire situation worse. A study published in JAMA Internal Medicine found that more than 1 million prescriptions are written every year for a medication that often doesn't address the actual cause of the problem it was prescribed to treat. That medication may be sitting in your cabinet right now. And later in this video, I'm going to show you a study involving 2 common blood pressure medications that researchers stopped early because the risks became too serious to ignore. But before that makes sense, you need to understand the chain. And the chain starts with your ankles. If you're taking amlodipine, you've probably noticed swelling in your feet or ankles. For many people, that's the first sign that something isn't working the way they think it is. Most people assume swollen ankles mean the body is holding too much water. So what happens? A water pill gets added. Seems logical. But here's the surprising part. The swelling caused by amlodipine isn't necessarily caused by excess water. Amlodipine relaxes and widens blood vessels. As those vessels widen, fluid can move into surrounding tissues, especially around the ankles and feet. That's why many people develop swelling. And that's why simply removing water isn't always addressing the real cause. Researchers found that medications like losartan or lisinopril can sometimes reduce that swelling by addressing the underlying mechanism rather than simply removing fluid. But millions of people never hear that explanation. Instead, they receive a water pill. And that decision can start a chain reaction that affects much more than swollen ankles. Because the water pill doesn't just remove fluid, it also removes something your body depends on every single day: magnesium. And once magnesium starts dropping, an entirely different set of problems can begin. Problems most people never connect to their blood pressure medication. Magnesium is one of the most overlooked minerals in the body. Most people never think about it. Most doctors don't routinely discuss it. But your muscles, nerves, and even your sleep depend on it. And when certain water pills remove magnesium day after day, month after month, the effects can be surprisingly easy to miss. At first, nothing dramatic happens. You don't wake up one morning feeling completely different. Instead, small changes begin appearing. Your legs cramp during the night. You wake up tired even after spending enough hours in bed. You feel restless. Your sleep becomes lighter. And because these symptoms develop gradually, most people never connect them to a medication. They blame stress. They blame aging. They blame getting older. But magnesium plays a critical role in helping the body relax and enter deeper stages of sleep. When levels drop, some people find themselves sleeping more lightly and waking more often throughout the night. And here's where the blood pressure connection becomes important. Blood pressure naturally falls during healthy sleep. That's one reason sleep is so important for cardiovascular health. But when sleep quality suffers night after night, blood pressure control can become more difficult. The result? Your doctor sees higher readings. The medication dose gets increased. The swelling gets worse. The water pill stays. And the cycle continues. Think about how many people are living inside that loop right now without realizing it. The swollen ankles are still there. The nighttime cramps are getting worse. The fatigue keeps building, and every prescription automatically renews every few months. No one stops to ask whether the original solution actually solved the original problem. One older adult spent more than a decade inside that cycle. She was taking amlodipine and a water pill. She experienced dizziness, falls, weakness, and everyone assumed it was simply age. What happened when her medications were finally reviewed changed everything. The woman had been taking amlodipine and a water pill for years. At first, everything seemed fine. Her blood pressure looked good on paper. The prescriptions kept getting renewed, and every appointment ended with the same conclusion: keep doing what you're doing. But her daily life was telling a different story. She was becoming dizzy more often. Walking felt less stable. Standing up made her feel unsteady. And eventually, she started falling. Like many older adults, she assumed it was simply age. Her family assumed the same thing. After all, she was in her 80s. What else could explain it? But when her medication list was finally reviewed as a complete system instead of individual prescriptions, something surprising happened. The medications that no longer fit her situation were adjusted. Nothing dramatic, no expensive procedure, no new miracle drug, just a careful review of what she was already taking. And within weeks, the dizziness improved. Her balance improved. Her confidence improved. Most importantly, she was able to walk farther than she had in years. Same woman, same age, same body. The difference was finally identifying the chain that had been running unnoticed for more than a decade. And that's the lesson many people miss. Sometimes the issue isn't a single medication, it's the interaction between multiple medications and the side effects they create together. Now let's talk about Losartan, because Losartan has a benefit that many people taking it have never heard about. Most people know it as a blood pressure medication, and that's true, but it does something else that makes it unique, something that becomes very important if you've ever dealt with painful joints or gout. And once you understand what Losartan is doing behind the scenes, you'll see why the next part of this chain becomes even more surprising. Losartan Preventive Losartan is just another blood pressure pill. Take it in the morning, check your numbers, move on with your day. But Losartan has a benefit that makes it different from many other blood pressure medications. It can help lower uric acid levels. Why does that matter? Because uric acid is one of the major drivers of gout, the condition responsible for sudden attacks of joint pain, swelling, stiffness, and inflammation. Anyone who has experienced gout knows how painful it can be. A joint that felt perfectly fine yesterday can become so painful overnight that even walking across a room feels difficult. Researchers have compared Losartan with other medications used for blood pressure control. Both medications lowered blood pressure. But Losartan offered an additional advantage by helping reduce uric acid levels. That's one reason many physicians prefer it for people dealing with both high blood pressure and gout. So if you've been taking Losartan and your joints have remained relatively manageable, the medication may be doing more for you than you realize. But here's where the chain becomes interesting. The same water pill that may have been added for swelling can sometimes push uric acid levels in the opposite direction. One medication may be helping lower uric acid, another may be pushing it higher. And because each prescription is often reviewed separately, many people never realize those effects may be happening at the same time. They simply notice that their joints hurt more, their gout seems harder to control, or their symptoms change even though they're taking every medication exactly as prescribed. That's why looking at medications one at a time can sometimes miss the bigger picture. The body doesn't experience them one at a time, it experiences all of them together. And the next medication in this chain may be affecting something even more important than your joints, your potassium levels, your heart rhythm, and even the way your body heals itself. That's where Lisinopril enters the story. Lisinopril is one of the most commonly prescribed blood pressure medications in America. For millions of people, it works well. It lowers blood pressure, it protects the heart, and it helps reduce strain on the cardiovascular system. But like every medication, it comes with effects that deserve attention. One of the most important involves potassium. Potassium is essential for normal muscle function, nerve signaling, and heart rhythm. Your body depends on it every second of every day. Lisinopril can increase potassium levels. For many people, that's not a problem. But when multiple medications, kidney changes, or other health conditions enter the picture, potassium levels can sometimes rise higher than expected. And that's why monitoring matters. Because potassium changes don't always create obvious symptoms. They often happen quietly, without warning, without pain, which is why routine lab work becomes so important. Now let's add another layer to the story. Some water pills can lower potassium. Lisinopril may increase it. Now you have two medications influencing the same mineral in different directions. And unless someone is looking at the complete medication list, it's easy to miss the bigger picture. Lisinopril is also known for another side effect many people never connect to their medication: a dry cough. Not a cold, not allergies, not an infection. Just a cough that seems to stay month after month. Many people spend years treating the cough without ever realizing the medication may be contributing. In some cases, that conversation eventually leads to discussing alternative treatment options with a physician. And that's where an important question comes into play. Are my symptoms coming from my condition, or could they be related to one of my medications? It's a simple question, but it can completely change the direction of an appointment. Because the goal isn't just controlling blood pressure, the goal is controlling blood pressure while helping you feel your best. And that's where the study we've been building toward becomes so important. Because researchers wanted to know what would happen if two common blood pressure medications were combined together. What they discovered was serious enough that the study never reached its planned ending. Now let's return to the study I mentioned at the beginning, the one researchers stopped early, not because it wasn't working, but because the risks became too serious to ignore. The study looked at two common blood pressure medications, Losartan and Lisinopril. Both medications can be effective when used appropriately. Both help lower blood pressure, and researchers wanted to know whether combining them would provide even greater benefits. At first, the idea sounded promising. Better blood pressure control, better protection, better outcomes. But that's not what happened. As the study continued, researchers began noticing a troubling pattern. Patients taking both medications experienced significantly more problems related to kidney function. They also experienced more episodes of dangerously elevated potassium levels. The risks became serious enough that researchers ended the trial before it reached its planned completion. Think about that for a moment. A study designed to continue for years was stopped early because the combination was creating more harm than benefit. And that's why medication reviews matter so much. Not because medications are bad, not because doctors are making mistakes, but because every additional prescription changes the overall picture. What makes perfect sense when one medication is prescribed can look very different when 3, 4, or 5 medications are involved, especially after age 60. Because as we age, kidney function changes, metabolism changes, and the body's response to medications changes. What worked perfectly 10 years ago may deserve another look today. Yet many people remain on the same medication combinations year after year without ever having a complete review of the entire list. Not because anyone is doing something wrong, but because healthcare often focuses on solving one problem at a time, one symptom, one appointment, one prescription, while the bigger picture becomes more complicated. And that's exactly why the final piece of this conversation may be the most important one of all. Because once you understand the chain, the next question becomes, what should you actually do about it? So what should you do with everything we've covered today? First, don't stop any medication on your own. That's not the message. The message is to start asking better questions. Because once you understand the chain, you stop looking at each pill as an isolated prescription. You start looking at the entire system. And that's where real progress often begins. The first step is simple. Make a complete list of every medication you take, every prescription, every supplement, every over-the-counter pill. Write them all down in one place. Then bring that list to your next appointment. Not just part of it, the entire list. Because many medication interactions are missed simply because no one is looking at the complete picture. Next, ask a few specific questions. What is my current magnesium level? What is my current potassium level? Are any of my medications causing side effects that look like new health problems? Are all of these medications still necessary today? Is there anything on my medication list working against something else? Those questions take less than a minute to ask, but the answers could completely change the way you feel every day. If you're taking Amlodipine and still dealing with ankle swelling, ask whether there are other strategies worth discussing. If you're taking a water pill and struggling with cramps, fatigue, or poor sleep, ask whether your magnesium should be checked. If you're taking Lisinopril and dealing with a persistent cough, bring it up. And if you're taking multiple blood pressure medications prescribed by different providers, make sure every doctor sees the same complete medication list. Because sometimes the biggest improvement doesn't come from adding another pill. Sometimes it comes from understanding the pills you're already taking. Remember, the number on the blood pressure monitor is only one piece of the story. Behind that number is a system involving medications, minerals, sleep, kidney function, activity, nutrition, and daily habits. When one piece changes, the others often change too. And that's why reviewing the whole picture matters. If you found this video helpful, share it with someone whose blood pressure has remained difficult to control despite taking their medications exactly as prescribed. They may not need stronger medication, they may simply need a better conversation. And if you enjoy practical health information designed specifically for adults over 60, subscribe and turn on notifications. In the next video, we'll look at 5 common over-the-counter medications that can interfere with blood pressure treatment in ways many people never realize. Take care of yourself, stay informed, keep asking questions, and remember, the pills may not be the problem, the chain behind the pills might be.